What up, guys? Welcome to another episode of Santa Cruz Medicinals Radio. We have Dr. Abood Bakri back in the house. Let's go. You have a nonprofit that you work with that you started?
It started. So
Nice.
it started on the DMs on Instagram. It's called GxzaHealth. Health. GxzaHealth. I'm bad at spelling, guys. We do telemedicine. We have the largest telemedicine practice that sees patients in Gaza. So like 2 weeks after the war started, we started seeing patients. It was me, my co-founder. We started seeing patients ourselves, and we recruited doctors across the world. We have like hundreds of doctors across the world that can connect with patients over sometimes WhatsApp or whatever contact they can get. And then if the doctor sees the patient, they prescribe them some kind of medication because the doctors there were overwhelmed with all the traumatic injuries and all the things. But we wanted to take care of like the diabetics and the hypertensives and the cardiac disease and all these other things that now people aren't going to get their meds. So we're able to connect them with a cardiologist or a primary care doctor or whatever doctor they may be. And then if they need a medication, we'll actually purchase the medication for them in Gaza. When the border with Egypt was open, we would get medications in Egypt.
Yeah, how were they? Did you have any issues getting people medication
Oh yeah,
there?
that's been supply chain's been the hardest part of this whole thing. Like at one point we got like hemophilia factor 9 medication smuggled across the border from Egypt for a patient. But now
seems like a war crime of some sort there.
Yeah, well, yeah. I know.
Yeah, so people can't get their meds, so you guys help them get meds.
So there's like meds in Gaza. The problem is it's like hoarding and people are like taking advantage of the situations. The med prices are so expensive. So now we'll actually just purchase the medication for them. And like we're purchasing over $50,000 worth of meds every month for patients in Gaza now. We're seeing like, I think 1,000, 2,000 patients a month, all asynchronously or through WhatsApp call. And we're making our own little EMR platforms so that patients can see that, because even though the war is over, not really over, people are still intense and they don't have an infrastructure. This is going to be in the next 5 to 10 years at least, if not more, for them. So we want them to have basic medical care that they can access.
That's amazing, bro. It's amazing you spend your time doing that. You don't have a lot of free time, and you spend some free time doing that. That's amazing.
Yeah, and honestly, dude, our team is phenomenal. Like the moment we launched it, volunteers from around the world, like, hey, we want to help any way we can do. We like top doctors that are making hundreds of thousands of dollars working for free for us. It was very exciting. So shout out to our team and all our volunteers to do that. Like we paused everything. Like I was making content, doing all this health optimization, building apps, but I was like, you know what? We focused on this for the last 2 years. Now we've hired all the best people in the right spots to kind of run this, because we know they're not going to be back to normal for a while. So we want to have access to medical care for people.
Absolutely. And how can people donate?
Yeah, so if they go to Gxza Health on Instagram, they can look up our website and there's a donation link there, GxzaHealth. And they can sponsor a patient. It costs like $50 to $60 to get a patient their medications. So we would appreciate that.
Let's go. I'm gonna go donate, guys.